The thorax is divided into three compartments: the right pleural space, the left pleural space, and in between the mediastinum. The pleural spaces consist of the lungs, the pleura themselves, the airways, the blood vessels, the nerves, and also the lymphatic drainage. The lungs lie within the pleural cavity. Some people imagine that the lungs sit inside the pleura much like this. The lung tissue sits inside of a bag, and they would say this is the pleural tissue and this is the pleural cavity. That's incorrect. In fact, the pleura is a sac within a sac. Another issue is that within the sac that makes up the pleura, we're going to require some serous fluid. This is an aid for lubrication. So we're going to shoot that in. There's a bit of serous fluid in there. And then we're going to seal it inside with sellotape. There we go. What really happens is that the pleura invaginates inwards. My hand is going in to sort of represent that. You can see it making a sac. This sac would exist at the hilum of the lungs, where the bronchi and the blood supply goes in, as well as the lymphatics. And so we're going to surround then the lung tissue with this sac, which is made of a sac. So now we have our lung tissue, and on the outside of the lung tissue, out here, we're going to have one layer which is going to represent the parietal pleura, and that will be up against the rib cage. If we look inside of this, we're going to have the visceral pleura. The visceral pleura will be applied directly to the lung tissue. And between the parietal pleura and the visceral pleura, we're going to have the pleural space, and inside of that, of course, is that serous fluid. And so the lungs then will be able to inflate and deflate, and we will be able to get some motion then between the visceral and parietal pleura, which is facilitated by that serous fluid. One thing to remember is that the pleural space is in fact a potential space. There's not air in the pleural cavity. It's full of fluid. Only in the case of damage to the pleura will we get air forming in there. Now we'll talk about the surface anatomy of the lungs. The lungs are, of course, paired structures sitting in a pleural sac. Now the lungs are attached to the other mediastinal structures. The heart, which is gone here, but would be sitting in this cardiac notch, and the trachea. So those are the structures that make up the mediastinum. If we look, the lung has a number of different surfaces. We have the apex of the lung here. There's the apex of right, apex of left. The apex will extend superiorly to underneath the clavicle, and sometimes even superior to the clavicle. This is an important issue because if you're trying to put in an arterial line into, for example, the subclavian artery, or in other structures in that region, you may puncture the lungs. The superior apex, the superior portion of the apex will be punctured, and it can be damaged. The other structure that we want to point out is going to be this region here, called the hilum. The hilum consists of the bronchus coming in, as well as the neurovascular structures, so the arteries, veins, and nerves. That is the hilum that we're talking about here. There's the left hilum, and then on the right it's not so obvious because the structures have been dissected away. If we look again on the anterior side, we will see that this part is going to be against the rib cage. So we're going to refer to this as the costal region. On these fixed lungs, you can see that there's a slight lump here and then again here. This impression is left from the rib cage. You wouldn't normally see that in lungs, but they've been fixed in that position. Other things that we can look at is on the right side. There's the right lung, has 1, 2, 3 lobes, and if we look on the left side, we'll see that we have only 1, 2 lobes. Now, to be more explicit, the right side with its 3 lobes will have a superior, a middle, and a inferior lobe. If we look on the left lung, we'll see that we have a superior, inferior lobe, and then this little structure that we refer to as the lingula. The reason that it's smaller on the left is, of course, because the heart takes up some of the left side of the thorax. The lungs are separated by a fissure. So there is the oblique fissure running down on the right side, and there's the oblique fissure running on the left side. The only difference is that on the right side we have one additional fissure, the horizontal fissure, running horizontally, of course. In order to understand the anatomy of the lungs and the pleura, we have to make ourselves familiar with the surface landmarks that we have in that region. So when we look at the surface anatomy of the lungs on a model, we can see a few things right away. First of all, we have the clavicle running along here. The clavicle is going to terminate down by the jugular or suprasternal notch. The lung itself is going to terminate in the apex, which is about here, and there's a dome on the top of the lung that we refer to as the cupula. If we follow a line that goes right along the clavicle, we're going to have our midclavicular line. So if we look on the right-hand side, we'll see the midclavicular line, and down to this level, here's the xiphoid. If we look here, this is the 6th rib. The lungs are going to terminate at about the area of the 6th rib, whereas the pleura will continue down to about the region of the 8th rib. So that's an area where there's a good separation between the lungs and their pleura. Now if we can get our model to turn sideways and lift up his arm, we can see here the mid-axillary line. So this is his axilla or armpit, and so there's the mid-axillary line. Now if we follow that to the 8th rib, which is right here, our 6th rib is up here, that is the end of the lungs on that side, and the pleura is going to continue down to the region of the 10th rib. Now, if we look on a model, plastic model, we can look here and see the same structures. Here is our suprasternal notch or our jugular notch, and there is our clavicle. We can follow down the clavicle in our midclavicular line until we get to the 6th rib. If we look there at the 6th rib, we'll see that's where the lung is terminating. Now if we turn this sideways, we can see our mid-axillary line, and there's our 6th, 7th, 8th rib. So you can see that the lungs are terminating along the mid-axillary line at the point of the 8th rib. As mentioned previously, the trachea will bifurcate into a right and left main bronchus. They're going to enter the hilum at that point, and then they're going to branch immediately into secondary or lobar bronchi. Each lobar bronchus corresponds to a specific lobe of the lung. There's the right superior lobar bronchus, the right middle lobar bronchus, and the right inferior lobar bronchus. On the left side, we're going to have a left superior lobar bronchus and a left inferior lobar bronchus. As the bronchi dive deeper into the lobes of the lung, the secondary lobar bronchi divide into tertiary or segmental bronchi. On the right-hand side, we're going to have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 segmental or tertiary bronchi. If we look on the left side on this specimen, we have 1, 2, 3, 4, 5, 6, 7, 8, 9 tertiary bronchi. There can be 8 to 10 tertiary bronchi on the left side. The right side is always 10. The most important thing to remember about the tertiary bronchi is that they provide the air for a specific bronchopulmonary segment. So what we're saying is This tertiary bronchi provides all the ventilation for one specific bronchopulmonary segment. Each bronchopulmonary segment has an independent blood supply, and we can illustrate it on this model. So if we take it and turn it around, we'll see the pulmonary arteries emerging here and here. Each individual branch of this pulmonary artery will be feeding a particular bronchopulmonary segment. Another interesting aspect is that each bronchopulmonary segment will have an individual branch from the bronchial artery. So the bronchial artery is actually going to emerge here from the thoracic aorta and send down its arterial supply along the bronchi itself, while individual branches will enter each of those bronchopulmonary segments. The upshot of all this is that each bronchopulmonary segment has an individual branch from the pulmonary artery and an individual branch of the bronchial artery. So when we look at the lung, we'll see that the lung itself is divided into lobes, and each lobe is divided into bronchopulmonary segments. These bronchopulmonary segments are divided by a very thin layer of connective tissue. The significance of this is that each bronchopulmonary segment has its own branch of the bronchial artery, its own branch of the pulmonary artery, and its own tertiary bronchus. What that means is if you remove a bronchopulmonary segment, perhaps because of infection or damage or cancer, then we're going to end up not affecting the other bronchopulmonary segments. In summary then, the lungs will be very resilient when exposed to surgery. As we continue from the trachea down the respiratory tree, we'll find that these tertiary bronchi will divide into segmental bronchi and then into subsegmental bronchi. The final major division will give us bronchioles. Now, what is happening when we get to these smaller divisions is that we're losing the cartilaginous covering. In the trachea and the primary bronchus, we have C-shaped rings of cartilage. If we get into the area of the tertiary bronchi, they have become rings of cartilage. Those rings of cartilage will slowly diminish until there's no cartilage around the bronchioles, or at least not complete rings. If we switch then to a model of the end of the respiratory tree, we can see that we've got here is a bronchiole. This represents the cartilage, which for the most part is not complete around the exterior. The ends of these bronchioles are what we call respiratory bronchioles because some respiration can occur. However, the vast majority of gas exchange will occur here in the alveoli. We'll turn these around, and you can see that it's made up of a number of very tiny arteries and veins that are going to be bringing in the deoxygenated blood, and of course oxygenated blood will be leaving. These are branches of the pulmonary artery that are coming down here, and this is the branch of the bronchial artery. So the final aspect of respiration is going to occur here in the alveoli, and that was the true purpose of the entire respiratory tree. And so, having discussed the terminal branches of the alveoli, we have now wrapped up our section on the pulmonary system.